by the keynote speaker, Dr. Kumaran, and we can take it from there. Ma'am, is that okay? From that. So just as a preamble, we have just been introduced to a whole array of development on the health front that Tamil Nadu has witnessed. And we can all bear personal witness to that. We're all products of the system. I come from Christian Medical College, Vellore, where I've been for nearly 3.5 decades, training as a medical student, getting introduced to the discipline of medicine, and having worked there for almost the same period of time, and finally into the institution's leadership. And I can summarize it by saying that it's a very proud feeling that all of us have to have been part of the healthcare training in Tamil Nadu. Much has been said about Tamil Nadu and its trajectory of development on the economic, social front, which we heard from in the morning. But it's particularly true for healthcare as well, because we know that healthcare is packaged in excellence in healthcare, not just in Chennai, but in places like Vellore and southern Tamil Nadu. So much so that it is the preferred destination for many people across India. There are several trains. If you look at the people who travel in those trains from Howrah, from Assam, all the way to Chennai, wind around Katpadi, go off to Bangalore. It's like a pilgrimage where patients come with their families and with everything that they have, because there's a high level of trust in the excellence that healthcare packages. So this is really the truth, and we are very happy to have been a part of this journey as well. What is it that we can talk about Tamil Nadu's healthcare? We heard a little bit in the keynote that it is developed on all fronts with the successive governments that Tamil Nadu has had. I saw a video just about 3 days back on, it's a video that came on the internet, which actually talked about Tamil Nadu almost taking over on all the parameters from state of Maharashtra. Starting from medical education, the production of healthcare personnel, almost 1 lakh of doctors who are produced, and who will then go out to different places and serve. It's also true of several state schemes that, again, Dr. Kumaran put up on this. What is to be highlighted is that all these schemes cover a layer of, they are all layered in one way, that it starts from preventive health care to home care to state-sponsored CMC HIS, the state CM's health scheme. It is now also beginning to address important niche areas like cancer care for women and many other things as well. There are certain gaps, and we will discuss that, but with this preamble, let me hand it to Madam Kanimozhi to give her opening statements. Thank you.
As the stage has been set by Mr. Kumaran, I think he has almost covered all the strata of the Tamil Nadu healthcare impact. I would just like to highlight one important aspect which I think is missed out. It is the vaccination for the cancer, HPV vaccines, which has been introduced by the government of Tamil Nadu on the month of January. As a pilot project, I think they have selected 4 districts, that's the Ariyalur, the Perambalur, the Tiruvannamalai, and the Dharmaburi, and around 23,000 school children, government and government-aided school children have been vaccinated for 23,000 number. It has been done as a pilot project. I think it's time we also look forward for catching up with the cancers also. That is also Tamil Nadu has put his foot into it, we should say. And this 23,000 number might be as a pilot, but I think the exams have also come up. The vaccination, since it starts in school, it would be continued after the exam courses, and it would be going across the other schools and other districts as well. So this is one of the most important earmark as set by the WHO strategic global set for us to prevent cancer. I think it is a model which has been followed from Finland and Australia, which has been introduced there for the last 10 years, and they have really curbed the numbers in great. So I think this is a role model which Tamil Nadu has rolled out. I think last week on Feb 28th, the government of India has also announced that it would be a national-wide vaccination. But I think it's been done in the primary health centers and the medical colleges. But even then, I think if it comes to Tamil Nadu, we would be much more benefited because our primary health centers is the backbone of Tamil Nadu's health infrastructure, which was started 5 decades ago, and that's where we really stay strong. And but not the least, the mental health, I think we have also put forth there. I think Dr. Hafiz would be more interested to talk on that.
Yeah. So, delivery of health service requires multiple things. It's not only infrastructure, it requires machinery, it requires people who can use that machinery as well. So, here it is a system where a skill set is very important factor. So, what this government has done, or previous governments of the DMK has done, is keeping that skilled person within the government system. In 1989, Talevar Kalaignar brought in an internal reservation for government doctors, by which the doctors who do specialty and multi-specialty do not go to the private sector. They come back to the same system and start delivering the service. That is one important factor why we are able to achieve such big parameters, high parameters when it comes to health-related indices. So that is one thing. And now, what is most important thing is, as the speaker has said, the accessibility is a question as far as healthcare is concerned. So this government has brought in 2 important things. One, by Makkalai Thedi Maruthuvam, this government has taken primary health services at the doorstep. With that, what we have achieved is at least 10% control in diabetes and hypertension, which was negligible previously. That is one achievement. And then at the second point, with Ungaludan Stalin and Nalam Kakun Stalin scheme, this government has taken tertiary care to the people, diagnosed tertiary illnesses, advanced malignancies, ophthal issues to super specialty treatment. All that has been done by this 2 specialized scheme brought in by this government. So that's something to look at. And talking about the mental health issue, this government has addressed it by investing 100 crores on a mental health institute in Chennai and focusing on telecounseling. Even the school education department has a district level counselors who are ready to address the social issues, the psychological issues of the school students. So by and large, this government has emphasized on primary care and tertiary care and ensured that there is accessibility and delivery of services. Additional to the regular health services, the mental health also has been addressed.
We have actually addressed a very comprehensive approach that this government has had as compared to other states where the focus is on sick care. Whereas in Tamil Nadu, historically, we heard this morning that the nutrition, the midday meal scheme actually was conceptualized as far back as 1921, if I'm not mistaken, and now it's been enhanced. So it is so important because we know from the statistics of other states that there's a huge problem about anemia in women and stunting in children, purely because of the nutritional deficits of whatever modern day or, parents not being affordable enough or whatever it might be. Whereas we don't have so much of a problem because this has been addressed by very carefully thought of nutrition programs, either through the midday meal scheme and in general, the preventive approaches that many hospitals have used to reach out to the villages. And I'm sure the the scheme that you mentioned, treatment at the door, not just addresses the physical ailments, but also anemia, nutrition related things. So it's a very robust situation which takes care of that. And of course, for the area that deals with sickness, there is all the schemes that are supported by the Chief Minister's health scheme and so on. Just had one question and would like your input on it. Tamil Nadu, I understand, is one of the states that's rapidly aging in terms of the projected geriatric population by 2027, if I'm not mistaken, will be nearly 17%. Now, this is the downside of development. It's because of good health care that people are able to live longer. But it does translate into certain liabilities that is created by this prosperity. So how good are we, ma'am? You will know better in terms of that projected, plans to take care of this aging population, which are of two kinds: healthy aging people and people who will have ill health as they age. Also some issues that may relate to mobility disorders and debilitated social isolation, very important. So in terms of institutionalized care or creating a discipline of home care, where is Tamil Nadu? I'm sure there is, but we'd like to hear from you.
Yeah, we also have a scheme. We put up medical camps on every Saturdays, which is covering all the super specialty departments like orthopedics, ENT, your physician, your cardiologist. We have people to do our echoes and if required, our CT angios referred to the higher centers. I think this has been done at all ward levels and zonal levels. I think that would take care of the geriatric care which you've been asking for. And I think currently the non-communicable diseases in Tamil Nadu, that is also being taken care with a good amount of physicians and with the pharmacies which has been advocated by the CM scheme. I think we would have a healthier geriatric population than compared to the rest of India. Because we started our footprints earlier, so we are far ahead of it, might be the answer for that, sir.
Yeah, I'm actually not asking the question. I know it's just to highlight to the audience that even on that front, we have a head start as far as other states are concerned, which is a good thing.
Yeah,
yes,
and very recently, this government has inaugurated specific hospitals and dedicated beds for geriatric care, which I don't think any other government institutes in the country offers. So that is the vision. Tamil Nadu thinks first, historically, as I said, in terms of keeping the doctors into the system. As we see that this is going to be a healthcare issue for the elderly, specific dedicated beds and increasing geriatric post-graduation courses in government setup. These two things are the primary thing that will address the issues as we see the aging population becoming more prominent in the state.
I understand that the government's made MD in geriatrics mandatory for all colleges, which is a far-sighted way of addressing this problem. Just one question, if there is time. What do you think about the sleep disorders in young children because of this gadget? They are addicted to this, causing scholastic disabilities, attention deficits, parents finding it difficult to manage them, and a complete change of culture. Is this going to be a public health problem?
So this problem is not only with the kids, sir. Even adults are facing this problem. So this has to be addressed comprehensively. So labeling it only with the kids, I don't think it's fair. It's a problem across the spectrum that needs to be addressed. Yes, as we said, the school department, the school education department, at least the government level, has counselors for that, addressing these issues timely.
On the lighter side, I think government should get into some rules stating that we have this many hours for screen time only. Probably that's the only thing which is going to really take care of all populations cutting across the age.
Do you think we have a need to also, because of the NCD avalanche, to have some government policies to ban, fast food and beverages in school canteens? Because they talk about it, but nothing is done.
That has to be done, sir. And I think the curriculum should focus on healthy habits, the nutritional values. There are a lot of things that are being taught by NCRT in the school which are controversial. More than that, I think they should focus on nutritional habits, the personal habits, and the long-term impact of such habits. And if they instill at the school level, I think that will be better. But I don't think the priorities of the union government is that. They are focusing on more divisive education than the education that is required for the students in reality. Thank you.